group of Sioux Falls businessmen formed a group called the Community Committee on Alcoholism and Drug Abuse and decided we needed a treatment center in the Sioux Falls area, and found this area, which used to be originally Augustana College and then Augustana Academy. And they brought in Lynn Carroll, who started Hazelden, which was one of the first treatment centers in our country, to be the program director, and that happened 41 years ago. We run about 90 patients. We have 122 beds. Sometimes we're full, but we run between 90 and 100 patients usually.
We know that a person's substance abuse problem isn't going to be cured in 30 days, 45 days, or even up to 90 days, that it's a day-to-day process. And a lot of research is suggesting that as a CD counselor, as a chemical dependency counselor, we're advocating for up to 5 years of care. We also address mental health concerns. And that there's a number of mental health concerns. We are level 3.7 level of care at Keystone, so we do have access to nurses, we have access to psychiatry, we have access to medical doctors. So there is a psychopharmacology avenue that we can also refer our patient to the psychiatrist that may be having a concern that could be aided through psychopharmacology.
A majority of our kids do have some sort of co-occurring mental health condition too. Anxiety and depression are the biggest. Everybody is different. Sometimes when they have that epiphany moment and they say, yes, I have a problem, it's easy for them to slip back into that familiar, I don't have a problem. So it kind of moves back and forth between that. It's 2 steps forwards, 1 step back. As long as they're making constant progress, we always want to see them moving forward. But it's not uncommon for kids to test the limits and see if they can use again, and see whether all these treatment counselors know what they're talking about. We see kids come back sometimes 2, 3 times, and they pick up something different each time that will help them in their recovery. Regardless of how they got here, they can still have that light bulb moment where they realize, you know what, maybe they got something there. Maybe there is a problem I need to look at. Oftentimes it's not the way we think it's going to be. We can't go out and say, yep, there's a problem with drugs and alcohol. They've got to start looking at it. Yes, I have a problem with my probation officer, and this is what I need to do to correct that, where substance use is a part of that problem.
I particularly like when the light bulbs go off, that it's not necessarily connected to something I've said or done. Another thing that's real beneficial at Keystone is we really work on the therapeutic community, so it's not necessarily contingent or that the progress in the patient only hinges on their work with their primary counselor or one of the doctors, that there's a microcosm of what their recovery program could look like after they leave Keystone.
There needs to be a power higher than Jack Daniels, and that's part of getting well, is discovering that.